Welcome to this session of Understanding Human Anatomy. In this session, we will talk about the rotator cuff. The rotator cuff is a group of four muscles that originate on the scapula and insert on the humerus. They act to rotate the humerus, hence the name rotator cuff, but they also are very significant in holding the shoulder joint together. The shoulder joint has a tremendous range of motion, the greatest range of motion of any joint in our body. The shoulder joint, to achieve that level of range of motion, has to have minimal bone-to-bone contact and also not as strong or as many ligaments as you would expect to hold this very important joint together. The body depends on the rotator cuff muscles to keep the humerus in contact with the glenoid fossa of the scapula. They literally hold the joint together. You can see in the slide that I've drawn a posterior view of the scapula with the humerus articulating with it on the glenoid. You have the acromion over here, spine of the scapula. Here's the coracoid process. Now, the first muscle we're going to talk about is one called supraspinatus. And supraspinatus takes origin from the supraspinous fossa, that area on the posterior of the scapula that lies superior to the spine. So I'm going to draw an outline of the muscle here. And then our view would be blocked by the spine and part of the acromion, and the muscle will be picked up over here, and it inserts on the greater tubercle of the humerus, right at the most superior part of the greater tubercle of the humerus. And let me color in the muscle. Like so. So this is supraspinatus. Runs from the supraspinous fossa to the greater tuberosity of the humerus. And it's the first of our rotator cuff muscles. Draw a line here. The second of our rotator cuff muscles is infraspinatus. And we'll draw infraspinatus in red. And infraspinatus takes origin from the infraspinous fossa. That part of the posterior of the scapula that lies inferior to the spine. And then the muscle runs over to insert on the humerus, on the greater tuberosity of the humerus, right next to the insertion of supraspinatus. It's just a little bit inferior to the insertion of supraspinatus. So again, let's color it in. Here. And this is infraspinatus. And we'll draw a connecting line to it. The third muscle on the posterior of the scapula, or originating from the posterior scapula, is teres minor. And we'll draw teres minor in brown. And teres minor originates from the lateral border of the scapula, and it also passes over to the humerus to insert just inferiorly to the infraspinatus muscle. So let me color this muscle in, and we can see the three insertions here. I'm just going to outline the insertions in black just to let them stand out a little bit. And this third muscle is teres minor. When we talked about the axilla, we talked about teres major. The difference between them is basically size. Teres major is a bigger muscle than teres minor. I should also point out that the term teres means round. So this muscle, if you were to cut it in cross section, cut through it from front to back, it would have a round outline, and when you palpate it, you can feel that it is round. Okay, teres minor teres minor. So these are three of the four rotator cuff muscles. The supraspinatus acts primarily as an abductor, and we're going to talk about how it works with deltoid at the end of this session. Infraspinatus and teres minor are lateral rotators of the humerus, and teres minor would be a weak adductor. Okay, now I'd like to take a look at the anterior side of the rotator cuff, the anterior side of the scapula and humerus, and the fourth rotator cuff, which originates from the anterior side of the scapula. The fourth muscle of the rotator cuff group is subscapularis. And subscapularis takes origin from the anterior surface of the scapula, the subscapular fossa. And this muscle then passes across the glenohumeral joint to the humerus to insert on the lesser tubercle of the humerus. So let me fill this in. This is subscapularis. The fourth of our rotator cuff group I missed a little coloring there. Subscapularis. And subscapularis is also a rotator of the humerus. It causes the humerus to rotate medially in its socket, and it also would be a weak adductor of the humerus. But you could see that these four wrap around the humerus and pull it into the glenoid fossa. They literally hold the joint together. And because the shoulder joint has such small amounts of bone to bone contact and also relatively few ligaments, these muscles hold the joint together, yet allow the tremendous range of motion we see with the humerus. The glenohumeral joint is a ball and socket joint, so that means it can flex and extend, it can ab and adduct, and it also can rotate. So it can move in all three axes. And it can do so far more than any of the other ball and socket joints. Far more than, say, the hip joint can do. And that range of motion, that large range of motion, that has a consequence, which means that the joint is relatively fragile. It can be dislocated relatively easily. And what you'll find is the most common type of dislocation is an inferior dislocation, where the humerus is pushed inferiorly out of the cavity. Now, in the next slide, I want to talk a little bit about abduction of the humerus. It seems like a straightforward motion, but it actually is somewhat complicated because of the different muscles and bones involved. Now, abduction of the humerus, or abduction of the upper extremity. That's because where the humerus goes in abduction, the forearm must go also. What we're going to find is that the deltoid muscle, which is the one we talked about previously as the major abductor of the arm, does not have a true mechanical advantage until the arm is partially abducted. The deltoid cannot act to abduct until the arm is moved about 30 degrees from anatomical position in abduction. The muscle that gives us this initial motion, this initial 30 degrees of abduction, is supraspinatus. So supraspinatus causes the initial 30 degrees of abduction. It is at that point that the deltoid takes over, that the deltoid acts. And the deltoid then will abduct the arm to about this point. So this motion up to here is caused by deltoid. Now, deltoid can't really pull the arm further superiorly, primarily because the greater tuberosity physically bumps into the acromion. There's bone-to-bone contact, and it can't continue. Yet we know that we can move the arm all the way up so that it's resting right next to our head. It can go completely vertical. So we can get to this position. This last part of the complete abduction is not caused by moving the humerus, but is actually caused by rotating the scapula. so that the glenoid rotates to look superiorly, allowing the arm to get the rest of the way up. And the primary muscle that does this is trapezius. So trapezius is responsible for this final bit of adduction. So three muscles, at least the primary muscles, for causing the total abduction from anatomical position a full 180 degrees so that the arm is vertical, pointing up. This concludes our discussion of the rotator cuff. In the next video, I will talk about the muscles of the arm. Thank you for your attention.